The conference highlighted the bed management crisis at the Millennium Heights Medical Complex, particularly in the Accident and Emergency Department. Millennium Heights Medical Complex CEO Dr. Dexter James addresses the increase in emergency room admissions following the COVID-19 pandemic, emphasizing that the department continues to provide comprehensive emergency services despite occasional concerns. He presented data from April 1st, 2023 to March 31st, 2024, showing that over 3,500 patients were treated during this period.
We achieve a 3.6 average score with respect to the quality of services we provide. There's a 71% satisfaction rating by these patients who provided the feedback. But the important dimension that we have to focus on is the Net Promoter Score. And this Net Promoter Score is simply patients who have come to the emergency room, how happy are they to say to the relatives that they must use the emergency room as opposed to do not come to the emergency department. And you see here the score is 68%.
According to Dr. James, 2 out of every 3 patients visiting the emergency room would recommend it. However, patient dissatisfaction focuses on bed management, overcrowding, waiting times, communication, and the timelines of diagnostic investigation results.
When you have emergency department overcrowding, it really impedes our ability to deliver care to our emergency patients. It overwhelms our staff and the resources and our physical capacity. That's the bed situation. And it creates challenges in maintaining a standard of care for the public that is acceptable and for our staff. Our staff are also huge advocates for good patient care.
Regarding the overcrowding in the Accident and Emergency Department, sicker patients require additional resources, interventions, and bedside time from both nurses and doctors, leading to longer hospital admissions.
The hospital has been grappling with a shortage of beds to care for our patients. This situation is further compounded by the increase in motor vehicle accidents and injuries due to violence such as gunshot wounds and stab wounds. As a result, some patients who require admission to the hospital are kept in the ER where they are cared for until a bed becomes available on the wards. Over the past few months, on any given day, the ER has between 25 and 30 admitted patients waiting for beds on the wards.
They are exploring solutions to address the issue, including the establishment of a special 7-bed unit called the Transition Unit, intended for stable patients awaiting transfer to a ward bed.
We have also made beds available at the secondary care hospital, previously known as the Victoria Hospital. Efforts have also been made to improve the overall experience when a patient arrives at the ER, resulting in a smoother flow, and this includes a new registration area and triage room, where the nurse now has greater visibility of the patients in the waiting area. And these works are expected to be completed by the end of June.
Meanwhile, the Millennium Heights Medical Complex team urges the public to prioritize self-care, maintain a balanced and healthy diet, drink alcohol in moderation, and resolve conflicts peacefully. Shane Stephen, NBC Prime.